It was our homecoming game, and it was a big thing. And I was ready to go out there. All my family was there. Fans were going nuts and everything. And I dropped back for a punt return. And as soon as I caught it, I took 3 steps forward, and I was going to cut quick outside to the right. And when I planted with my left leg, it bent left instead of straight. And so that gross feeling like it was dislocated and loud pop, I was like, I just laid on the ground, whistle blew, and I was like, I'm never going to play football again. And that was just crushed.
Yeah, when Jaeden came to clinic, I explained to him and his parents kind of the injury to the ACL. When someone injures their ACL or ruptures the ACL, it's a scenario where you can't actually sew the pieces of the ACL back together. You have to reconstruct that with a piece of his own tissue, which we talked about. We also talked about recovery time. It's closer to 9 months that we usually get people back. In his case, we were able to get him back a bit sooner than that. But it takes a lot of communication with the therapist as well as Jaeden himself in terms of how he's feeling with his knee, and a lot of that comes down to strength of the knee.
So actually, the biggest fear in my life at that time, like my whole life, was tearing my ACL and having surgery. Like I was deathly afraid, and surgery especially. And yeah, I was very scared when I heard that.
Yeah, so a torn ACL, especially in a young, active student like himself, that's a kind of a career or a season-ending injury. But we try to get people back after that. So usually that's an operative case, and so the way that we do that is we actually reconstruct the ACL. The ACL is actually in the center of the knee. So if I kind of peel back this is the kneecap that I've got down here, but the ACL kind of runs up the front of the knee here and actually goes to this part of the femur here on the outside part of the knee and actually stabilizes your tibia in relation to the femur. So it doesn't allow for a pivoting type of movement to injure the rest of the structures in your knee. And so Jaeden had ruptured that.
Dr. Awowale was great. I mean, he knew how much of an athlete I was and how much I wanted to get back out playing. And so he also knew I had a future in maybe playing after high school in sports. So he wanted me to get in the best shape and best hands as I could possibly get. And he provided right on the spot. So, I mean, he was there for me every checkup I had until the day I got cleared.
So ACL injuries, although can be devastating for the patient and their family, is a common injury that we see in clinic quite a bit. Working with our therapists after the surgery, we are able to get people back to doing the level of activity they were doing before. There can be other concomitant injuries inside the knee to the meniscus, and we usually address those at the same time as the ACL reconstruction.
If I think about where I started, not having the mentality, like I was just depressed, and I was like, oh, this sucks. Like I'm never going to make it back for baseball. But then once I flipped the switch and I was like, I'm going to take it one day at a time slowly, and who knows, maybe God will be by my side and lead me through it. And I was like, wow, I actually did it. And like I was determined right away that I'm like, coach, I'm not going to miss baseball season. But then actually capitalizing on what I said, I was like, this is awesome. I was in great hands, and everything turned out successful. So